Hi, welcome back to Only Seniors. My name is Tom Callahan and I'm your host. Today's episode, we're going to be talking about some really important issues facing seniors. What is home care and what is adult daycare? If you don't know what these are, this would be a great time for you to learn. We're going to talk to some experts in the field. My guests today are Hilary from Buckingham Adult Daycare and Home Care, Karen Groder and Jill Lettice from Stellar Home Care. And let's get started. Hilary, tell me a little bit about Buckingham Adult Day and Home Care.
Okay, thank you. Many people are not familiar with what medical and social adult daycare programs are, but primarily they are a safe place where seniors of all types and chronic conditions come together for a day of activities, socialization, meals, and therapeutic oversight by a nurse. So it's a safe place for seniors to come Monday through Friday.
Great. Do they do activities? What do they do during the day?
Yes. Well, most people are curious about the activities. So, of course, we always offer the family to come in and see what we do. So many people are familiar with the senior center, right? You come and you do activities, and there's a variety of things offered. And so what we do, the difference really is many people who come need assistance or maybe supervision and support. So they are doing exercise together, they're having a hot breakfast, they're enjoying a hot lunch. And so the bottom line is it's a social place for people who would otherwise be at home alone, sitting in front of the television a lot of the times.
Wow. I understand socialization is a big factor in senior adult day, mainly because with people, like you said, sitting home in front of the TV, they kind of veg out. But at least this way they get some interaction.
Absolutely. And we see some really beautiful encounters with not only the women, but also the men who maybe have a more difficult time socializing with other people. Many of them have worked their whole lives, so they're not really used to sitting in a social setting. But once they get there, they meet other veterans and they have a great time and connections are made. Often people are from the same area, let's say in New York City, and they just have a great time. And that's what it's all about. It's all about having fun and being safe and making sure their medical needs are taken care of.
And I also understand that one of the biggest things facing seniors with this non-socialization is they get depressed. So I guess this would be something that would really help keep people from getting depressed, get them out of the doldrums, get them really active and out there. Do they do any sorts of exercises?
Yes, what do we do?
Yes.
Well, you're right, Tom. As soon as we get the residents arrive at 9 in the morning, we have breakfast, and then we transition into music therapeutic activities, exercise class. So a therapeutic exercise instructor is doing armchair aerobics to all kinds of music. We even have Zumba on Fridays where an instructor comes in and no, they're not doing cartwheels, but they're in their chair doing a lot of sort of interesting moves. And it's amazing what you can do sitting down. And then we have small group activities for people who enjoy Jeopardy, crossword puzzles, who enjoy using their minds or maybe doing current events. They like to keep on what's going on with the day's events. So people who enjoy the more outgoing activities, that's there, as well as people who enjoy doing arts and crafts. For whatever reason, they're not exactly, they couldn't follow a crossword, but they can do painting and arts and crafts. So there's a lot offered.
Okay. And where is Buckingham Adult Day located?
Okay. Well, we serve, and it's really important for people to know, is that we serve the whole Mercer County and Middlesex County. And so our vans pick up clients all over, from as far south as Robbinsville, Hamilton, Lawrenceville, Trenton, Princeton, all the way north to North Brunswick and Monroe Township in Princeton.
Okay.
So
you pick everybody up?
Most people, I would say 90% of our clients we pick up.
Better, right?
Yeah.
Okay. And what time do they get there and what time do they leave?
Okay, so we're open Monday through Friday, and usually participants are there from about 9 o'clock until 2:30, or they can stay a longer day till 4:30.
Okay.
And there are funding sources. I don't know if you want me to go into that, but basically people typically say, oh, I can't afford a day program, it's too expensive. But really, it's very affordable for most people in that there are different funding sources through the state and local counties that are offered, and we can sit with families and figure out what their income and their assets are and see if we can match a funding source to meet their needs.
Great. Great.
Yeah.
Well, Karen and Jill. Karen Groder and Jill Lettice from Stellar Home Care. Tell me about your company.
Well, we are a home health care agency in that we do both skilled and non-skilled home care. There's a difference there are some non-skilled agencies that only provide home health aides. We do home health aides, live-ins, we also do nursing, physical therapy, from all different ranges. We can do around-the-clock nursing, and we can do just visits, going into poor medications or wound care, G-tube feedings.
G-tube feeding. What is G-tube feeding for the people who don't
But
know?
if a client is not able to swallow properly
Okay.
or safely, then usually they would be fed by a tube that goes directly into their stomach.
Okay.
And there are some things that have to be looked at when they're being fed by a G-tube. So we will have our nurses go in and do the cleanse the area and also do the feeding, which is developed by the doctor, is going to tell us what to feed them, and we can also put medications in so that they don't aspirate while trying to swallow.
Perfect. That's not something I would want to attempt as a family member, that's for sure. That would scare me a lot. Jill,
Yes, sir.
tell us about what type of clientele you have.
Oh my goodness. We pretty much cover the gamut of homebound clients. Any age group. We have had infants. We have had 15-year-olds that have been in car accidents and are just recovering, and on to the senior population. Predominantly senior population. Of course, geriatrics is really where most of the home care clients come from. But as Karen said, we have hospice patients who are terminal and really basically just receiving comfort care, and we're there for emotional comfort as well as bathing, dressing, but assisting. They don't do very much, and we're there to give the family, that emotional support. And we go right up to the nursing stuff that Karen is speaking of, wound care and medication administration and anything in between. If you can think of something that can be done in the hospital, almost all of it can be done at home with the right team. So we really have all of it. We really do.
Now, I know what a lot of people that I talk to say is they want to keep mom or dad home because that's where they're most comfortable. So home care actually perfectly fits in there. What I see a lot of people trying to do is do the care themselves, and unfortunately, my feeling is that they always end up doing, even though it's brought from love and they really want to help their parents, it kind of sometimes isn't the right things to do. Like, I would never attempt to G-tube feed somebody. I mean, no, wouldn't work for me. So tell us, what are some things that you're seeing when you go into a home that maybe people shouldn't be attempting with their loved ones?
G-tube feedings.
Okay.
I shouldn't
Number
say
one.
that. I shouldn't say that because our staff will actually train a family member to do a G-tube feeding properly if that family member is interested, or if possibly money is an issue and they can't afford to have around-the-clock nursing, because that can only be done by a nurse or a family member. It cannot be done by a home health aide.
Okay.
So if finances are a concern, we can train the family members to do it. And there are some family members that are willing to do it. So I have to retract that. I was just being funny. However, lifting, helping a patient transfer from a bed to anything else, and doing it improperly and hurting themselves is always a concern. Proper safety in any moving of the patient in any way, bathing. Even dressing, sometimes you're bending arms that shouldn't be bent in certain positions. And so we see a lot of things that the family could be taught, and some family just don't want to do it. And then on that note, the other things that we see is the neglect aspect of it. They don't want to do it, so it's not being done. So that client may be bedbound and not in the cleanliest status. So our staff can go in and correct that situation through training and by doing.
I think also you have to protect the relationship between a parent and a child, or a grandmother and a grandchild. It's very difficult for you to say to your loved one, it's time to bathe. Let me help you bathe. If my mother tells me no, it's no. And so when we have a home health aide going in, typically they're in a scrubs or uniform, and there's a different acceptance of that care. So I think that helps a lot. And nothing like being able to be the child again and not the caregiver.
We can speak firsthand on that. We are sisters, as you know, and we have been in this business for well over 25 years. My mother started a home care agency when we were teenagers. So we've grown up learning the business before there was such a thing as certified home health aides and so forth. Really have learned it from the ground up. And we have recently found ourselves in the position of being the patient's family. And it is an eye-opener
different.
to very trained people. You know, we have spent our lives saying to our employees, this is what you do when you get there, and this is how you do it. And now our 98-year-old grandmother lives with me. And holy cow, what an eye-opening experience it has been for us to be able to really relate with our staff more. Because it's, you know everything from behind the desk. It's really amazing to be living it. Really, really is.
Great. I think this brings up a topic for all of us to really be discussing is the impact of what each of your companies does to help the family. If you can all speak to that, let's start. Hilary.
Okay, well, it's interesting because we do work with home health agencies very closely because many clients who live at home, they not only need care at home, but sometimes they would benefit from a social outlet, especially if it's a couple, an elderly couple living alone, where, maybe it's good for the spouse, the well spouse, to get out of the house a couple of mornings a week or a day. And so a day program might be appropriate. And so we work together by really trying to support the family and giving them a respite break. I think that's the whole thing is, like you say, Tom, so many families think that they, out of guilt or loyalty, that they must carry the burden because they're not going to be a good husband or wife if they don't take care of their loved one. But what happens is then they burn out and they get sick, and then what happens to their spouse or their family member if they wind up in the hospital? Who's going to take care of that person?
Right.
So it's all about, I guess, education, giving family tools to navigate the system, like caregiver support groups, daycare, home care, and finding out that it's not as expensive as people think it is. Because I think that's what you had alluded to earlier.
Yeah, people don't realize that it can be, what you spend in care is so minimal as opposed to what you get back, because you're getting back a life with your loved one, is what I always think. You're not mom or dad's nurse anymore. You're not their playmate. You're their daughter or their son again, and you're able to have a quality relationship. I mean, and that is worth a multitude more of it. So tell me, same question.
Well, I think for many family members, their outlet is getting to go to the grocery store or having to go to the pharmacy, errands. That's the time that they get out. And so if we can provide someone with just 4 hours, they can go to the pharmacy, but they can get their nails done, they can take a bubble bath, they can go see a movie, like really enjoy a break, because as Hilary said, we have seen family members crumble because they're trying to do everything. And it's really unfortunate because most agencies will do 4 hours, some will do 2 hours, some only want an 8-hour shift, but if we can make it easy for one day, it's a big benefit.
It's something that we pride ourselves on, is giving a client what they need, not what we want them to have. If somebody says, I can only afford 2 hours a day, we'll do that. If we're going to give them what they need, that's what they need. It is.
It's interesting, a little different topic,
Sure.
But it's always interesting to find out how individuals got into the senior living and elder care industry. And from what I always find, it's usually not the first choice in careers, even though you grew up in it. Hilary, how did you get involved in senior living and elder care?
Oh, I had a feeling he was going to ask me that first. I'm going to sit over there next time. Well, actually, I had a career before this. I was in commercial real estate. So I wound up working with remember Classic Residence by Hyatt? They were
Yes.
starting senior residence and they needed space. They needed a building. So I was helping them to find a building, and I asked him, what is this senior industry? And he told me about it, and I said, oh, that's interesting. I love working with the older adults. So I wound up volunteering, doing activity surveys for the Classic Residence Hyatt in Teaneck, New Jersey. For about a couple of months, I just volunteered to see if I liked this field, and I wound up loving it. And then I went back to school and got a degree and decided to get into sales and marketing in assisted living and CCRCs. And that's how I got into this field.
That's how you got into the field. Karen?
I had no intention of being in this field because I grew up in it, and I saw how much time and effort my mother put into running her agency, and I blinked and it happened. I graduated from college. My degree is psychology, and I was working in that field, and I got a phone call that my mother needed me, and I came home. And I've really just fallen in love with it ever since, and I've become a nurse in the meantime. So it's really where I want to be. I love doing this.
It's in our blood.
Yes.
It really is in our blood. None of us intended on being in the field, my brother included.
And he's with you as well?
Not anymore. He's actually a police sergeant. He left a long time ago, but my mother, one by one, pulled us in. Karen was first because she needed help. I got pulled in because she was tired of me borrowing money because I couldn't pay my bills with my actual career. She said, are you ready to come on board yet? And it does. It grows on you, and it really is in our blood and in our heart. We sold my mother's company in 2007. And it was a very, very emotional decision to make. It was 25 years old, and it was her blood, sweat, and tears, and we carried it on. And I remember the phone call that very late evening, 10 o'clock, and we were both in our own offices. And she said, are you done? Have you had enough of this? And so we sold it. And within, 4 months, Karen was becoming a nurse, and I was with another home care agency, and you can't shake it. You can't shake it. The love for what we do is, it's immeasurable. It really is, and it's extremely rewarding, really, in every way.
When you get that phone call from someone saying, I don't know what to do. I don't know what to do with my mother or for my mother, and knowing that sight unseen, we can help them. That is very powerful.
It is.
It is. Now, how do people go about finding you? When somebody's looking for adult daycare, is that something you can Google and just say, Google adult daycare, and do things pop up, or do you have to look for a specific topic?
Yeah, that's a good question. I think you can Google it, you can do a search, but a lot of people don't even know it exists, Tom, and that's what I think we try to educate people about is adult day program can be, it can be a real lifesaver for so many people, and I think word of mouth is strong. We get many referrals from people who live in cluster active adult communities where we have clients already coming in from these communities such as Monroe Township, and word of mouth will really travel fast. And the other referral source are doctors. Many doctors and gerontologists and geriatricians and other internal medicine healthcare professionals, they know about us. They know adult day programs exist. So it's really just a matter of finding one that suits your needs, that's close to your home, that you feel comfortable in having your loved one come to. So we always encourage a free guest day so families can try it out. And like we were talking about earlier, one of the things I found that families really need to be encouraged to do is try it, whether it be home care 1 day a week or 2 hours a day 1 day a week, or daycare 1 day a week. Just try it, get your feet wet, just see what it is. I think many people put up obstacles and they assume that their parent isn't going to like it. I hear that so often. I think that's so sad because it's really the adult child who's having a difficult time.
It's very true.
And I say, you know what, I understand that. Come in and let me show you before you bring your mom or dad, and I promise you will feel better bringing them over. So it's always baby steps in this field, you know.
Yeah. What is something people should look for when they're looking for adult daycare?
Right. Good question. You should always come and visit and see the other participants, see how they are being treated by the staff. Make sure you feel very comfortable. Spend the whole day there, the first guest day visit. We always encourage families to come in anytime during the week and look and visit and observe. Use your observation skills. Make sure that all the participants are being cared for, that everyone is clean, that the food is good. So sample the food and speak to the administrator. Find out what their background is, why they're doing this. Some people are in it for reasons, and other people are in it because they enjoy it and they love it. And that will become quite evident when you visit a facility, whether it be home care, assisted living, or daycare.
Okay. Karen and Jill, what is something people should look for in a home health agency? What are some tips you can give the viewers?
I think first of all, you want to make sure that you can reach someone at any time. We want our phones are forwarded to one of our office team members who can help with any crisis. Definitely licensed by the state and follow the regulations. We've got liability insurance, workers' comp insurance, and that's basically if my team member gets injured in your home, they're covered under my insurance. They won't sue the client. If the client gets injured for any reason from my team member, I have an insurance policy in place that would cover any needed
Any
care.
liabilities.
Any
Okay.
liabilities, right. We also open every home care case with a registered nurse assessment. They go out and revisit every 2 months. I do unannounced pop-in visits to make sure that the caregiver is in place, following the care plan, not sitting watching television, engaging their client, and doing what is necessary.
I think making sure that the staff is being supervised, being in someone's home and being the only person in there taking care of somebody opens the opportunity for things to happen that you wouldn't want to happen necessarily. So you want to know that they are going to be supervised, that their nurses are going to be coming out. And as Karen said, the drop-ins by the supervisors, which is our prerogative to do that, and the families are usually comforted by that. You want to make sure that the staff being sent in has actually been trained by a professional school, whether it's nursing or home health aides, and that they are using simple basics like universal precautions. They know what they're supposed to do and not to do. So those things are all important. And I think the other thing that they should look into is what financial assistance is out there for them, because there are programs in place to help families who may not be able to afford the private duty home care, which is what we do, as opposed to Medicaid and Medicare, which we don't. There are other county programs available to assist them, and they should do their research and ask. If you call a reputable agency, they should be able to guide them for that.
Very good. Okay. Well, with about a minute left in our show, what I want to do is get you to tell me your company name again, your website and phone number so that people can get in touch with you. Hilary.
Okay, Buckingham Place Adult Day Center. We're located at 700 Woods Lane in South Brunswick, New Jersey. And the telephone number is 732-329-8954.
Okay. Website?
buckinghamplace.net.
Okay. Great. Karen and Jill.
It's
Not in unison.
No, and I'll let Karen take this.
Stellar Home Care and Staffing. Our address is 149 South Euclid Avenue in Westfield, New Jersey. Telephone number is 908-264-8729. Our website is stellarhomecarenj.com. And hopefully soon we'll be opening in Middlesex County as well.
Very great.
I just have to add with home care, the location of the office is not important. We cover the state. I mean, you call us, we'll do our best to cover it. It's just where her paperwork's done.
Well, I'd like to thank each of you for joining me here today on Only Seniors. I think we had a great discussion. I think we gave our viewers a taste of what is available to them. And I think each of you made it very clear that you should ask questions.
Absolutely.
Don't be afraid to get help. Finding help from mom and dad doesn't mean that you're giving up. It actually means that you're helping. It takes a strong person to admit that they need help. So, don't think that turning them over to an adult day or a home health agency has failed them in any way. You're actually helping them and you're helping yourself. I'm Tom Callahan. Thank you for joining me on Only Seniors, and I look forward to seeing you again soon.